Welcome everybody. I think we'll get started. Welcome to our fourth national learning event for the Reconditioning Games. Welcome everybody this afternoon. We are joined by some really great speakers today, and first of all, kicking us off will be Geraldine and Deb from the east of England, and then Joe and Trish are going to follow on afterwards. I think just to give, I'm not going to do too much of an introduction because I'm sure Geraldine and Deb will introduce themselves and Joe and Trish afterwards, but it's just worth recognising that we wouldn't be here today without Geraldine and Deb and all the great work that they did last year on the deconditioning games in the east of England. I think it was about this time last year that I first spoke to Geraldine and Deb, maybe a little bit later than this, but I was blown away by the work, and that really inspired us to launch the Reconditioning Games this year, and they've been so helpful and kind in sharing all their learning from the deconditioning games last year. We're so grateful for that. So we genuinely wouldn't be here today without the guys you're going to hear from today, and they're always inspirational, so no pressure. I'm expecting nothing less this time from Geraldine and Deb. As usual, questions or comments in the chat. Colleague Lucy is here today keeping on the chat for us. We won't do questions between sessions. We'll hold questions towards the end, but please hold those in your head or write them down or stick them in the chat, and we'll pick those up afterwards if we need to. So any thoughts or comments, please do put them out there. We are recording this session, so that'll be made available afterwards. I'll put links in the chat so you can pick it up later on to the recording, and I'll share it out on social media and through our usual networks as well. So keep an eye out for that if you want to share this recording with anybody else who couldn't make it today. So I'm going to hand over to Geraldine and Deb so we can hear from them. I'm just going to share the slides for them. While I'm sharing, Geraldine, Deb, do you just want to quickly introduce yourselves, and then we can get started?
Of course. Thank you, Nick, and thank you for that lovely, warm introduction. We've been ably assisted by some wonderful people, including yourself and Helen and Dr. Ahmed at ESIST, and the wonderful teams across the region and yourselves. So I think we've just been a catalyst in it all. But I'm Geraldine Rodgers. I'm the Director of Nursing for Leadership and Quality here at the East of England. And here is...
And I'm Debbie Whittaker. I'm the Regional Lead for Discharge and Quality at East of England regional team as well, nurse by background.
So we're delighted to be able to speak with you today, because I'm a great believer, and as is Debbie, is on the power of purpose. I think it's something we underestimate in practice, and it's something we underestimate in life. So, for example, what made you get up this morning? What drove you to here, and rather than your car? What matters to you? What deep in your heart that connects your heart and your soul together, that drives you forward, that gets you to live? Because in life, we only get one chance. As of today, the 9th of March, it's only the 9th of March. We'll never have that opportunity again. And I'm often mindful, and sometimes the patients we were looking after is today, they'll be watching a soap or a countdown or chase on the TV to suddenly find themselves in hospital tomorrow, where life will never be the same again. And how do we find out their purpose? How do we know what makes a difference? Because ironically, in those 24 hours, their life will change indefinitely. For some, they may not return home. For some, it'll be the end of their marriage as they know it. And for some, they'll end up in a new chapter in a care home, and life will never be the same again. So it's important for us that we engage, and it's important for us to know actually what really matters to people. And the key is what's the matter, but what really matters to you. And be mindful as well that sometimes what matters to you today may not be the same as what matters to you tomorrow. We had recently a loved one in hospital, and what mattered them today was obviously family, etc. But when they went into the hospital, they said, what matters to me is now is that I come out of here alive. And that can be such a powerful thing that you need to be able to know, what is that? So it's a very simple question, and it is the magical 4 words of is what matters to you. And it can be asked in many ways, because some people find it quite a difficult question to answer, but you can rephrase it in many different ways. But the key is that you incorporate it when you do ask it and you find it out, that you incorporate it in care plan so you can really make a difference and actually empower that care plan. Know the hook of what gets people, what drives people, what engages people, so that they will engage in therapy, that they will engage in their treatment plan. It'll improve outcomes, it'll build trust, it'll show you respect them and that you respect them as a person and they're not working to your agenda, that you're working to theirs. It'll strengthen relationships. But for staff, it helps you to really understand quality of care provision and gain joy at work. And I cannot underestimate that, because ironically, by unhooking somebody and finding their purpose, ironically, amazing things can happen. So we'll go to the next slide of why this is important. Debbie, I'm handing over to you.
Thank you. So through these games, we now have a much better understanding of the impact that deconditioning has on people in our care. But to truly understand what matters most to our individuals, the individuals that we're caring for, will really help to drive our quality improvement, and it will to have a much wider impact in all of our clinical settings. If what matters most to a person is to return to their own home, the evidence helps us to consider how an individualised care plan can help people to regain or maintain their independence, to promote continence, not incontinence, to increase their strength and their balance, and to improve confidence so they're able to achieve their aim and their goal. Next slide, please, Nick. So it's so important that we see the person. This slide is about bringing together hearts and minds. It's about asking people what matters most to them. It's much more than a question. It is about asking what matters most to them, but it's about listening. It's about really listening to what matters and then supporting that person to do what matters most. Having conversations that really do support embracing risk and enabling choice will really very much support this approach. It's not always easy, but it is really important that we stop seeing the patient and we start seeing that person, and we really find the purpose. It sounds a real cliche, but focusing on what I can do rather than what I can't do is so important. It is really the fundamentals and the basis on what this is all about. On our Futures site, the East of England Futures site, there is a fantastic video that Steve Judge, Paralympian, recorded for us just on this subject.
And I think when you look and focus on this, because how many times have we seen the line not fit for rehab? And therefore that focus on not showing or looking at what people could really do. And ironically, then that can be, for some, it's nearly a life sentence, isn't it? Because life isn't quite the same once somebody writes that in black and white, and the whole direction of travel focuses on them. And for some, they need a chance to recover. And I don't know about you, but if I haven't had an awful lot of sleep, and I haven't eaten the foods I normally like to live, and I'm in a strange place, actually, I'm not in my best. And ironically, for many people, they're in that strange place. They won't have eaten their normal diet. They won't have slept for ages. And also, they've had a really bad infection or a huge incident happen to them, like a fall. So life isn't quite the same. But how can we see that person to get them of where they want to be? It's really important. So when we say that line, we have to kind of have some sustenance behind it as well, because ironically, sometimes, and a lot of the time, we have to give people hope where there has to be hope found. And so what does that look like as well? Next slide, please, Nick.
So we're all here today because we are either taking part or wanting to take part in the mission to recondition the nation. And this slide is just a reminder that the fundamentals of this campaign are really very much built on a what matters to me approach. It very much encourages us all to be creative. It gives that creative license to staff at every level within our organisations and within our services. And it very much promotes that personalisation and makes sure that activity improvement, quality improvement and reconditioning is accessible and inclusive to everyone. We've heard some amazing projects and stories through these learning events of where this is really coming to life. And it very much supports the tailoring of that improvement work to individual care settings. And most importantly, as this picture demonstrates, it brings joy. It brings joy to all of those people that we're caring for, their families, and to the staff caring for them. Next slide, please.
So the purpose, discovering purpose can be the key to success. If you keep purpose front and center in your daily decisions, it's amazing how many doors it'll unlock. It's about nurturing hope or regaining or improving health. I've been amazed, and sometimes I've been doing care plans, and sometimes if you did a RAG rating and some patients would see that they were red, they'd say to me, what do I need to do to get to green? But until they saw that red, actually, they weren't able to engage in their care plan. So ironically, it's about how do we empower people? But by empowering them as well as how do we respect their personal wishes and how do we ensure their needs are met? It's about making life meaningful. And for some, that's meaningful again, because for some, they'll have lost hope a while ago. But how can we figure that again and not make sure people give up before it's time to give up? It's about making a real connection. Now, I've written there about making life even at the end of life. And I'm very fortunate. We both work with the end of life team. And we were fortunate to hear a wonderful story where medical doctors go into hospitals at end of life care. And they'll ask people who are literally days, hours off, who are able to communicate, actually, if I'm looking after somebody again, what do you think I should say? What do you think I should do? So even when people are in the last hours, they still have purpose and that they're informing agenda that they can make life, even at the end of life, different for other people. And I think that's a real powerful thing, that you have perfect right to the last hour of your death. And I think that's really key to success. And it's by telling stories about how we really make that difference. And so those of you who are very keen and visual will see during the slides, I've given you all clues, and I don't know whether anyone has seen different random things on my slides. And you can pop it in the chat if you've seen anything random that you're thinking, I'm not sure what that is. And she's not talking about any wool or needles. But I'm going to tell you a story. Well done, wool and needles. I'm going to tell you a story. I was working in the community and I was fortunate. I got to meet the most loveliest lady. And it's amazing how some people will always hold in your mind. And I think this lady will hold in my mind forever. And she was 99. And at the time I was on the virtual ward. My job was to keep people out of hospital. That was our mandate, and we would do whatever we can to make sure that they were looked after at home. Now, this lady, as I said, about to become 99, she was 99, about to become 100. And one day she rang the ambulance 9 times. And of course, at 99, anyone that came, God, they were all fabulous and they were all younger. But of course, at 99, you won that privilege, didn't you? And she would and one day I thought, she'll go into hospital and she won't come out. And if there was anyone that deserved to be 100, it was this lady. She'd been abandoned at birth, raised by Bernardos. She married her childhood sweetheart at 18 and went on to have 10 children. By the time of this age, 99, she had 100 live descendants by her. What mattered to her was that she reached 100. What mattered to her was the celebration of her life. And so I really was trying really hard, although I found out what mattered to her, is how could I unhook her potential to reach to her 100th birthday. So that's where the wool and the knitting comes in. She loved to knit, she loved to crochet, and she loved Emmerdale. And I'm not sure if anyone of you are brave enough. Sometimes when I'm on these calls, not everybody admits to liking Emmerdale, but I know people secretly do. And so I watched Emmerdale to see if I could enter Mabel's world, to see what I could do and what I could see to unlock her potential, to find out what matters to her, because I was trying everything. And there was the dingle sofa with some knitted blankets on. And I thought, my goodness, I have the hook. So I went the next day and I said to her, oh my goodness, I watched Emmerdale last night and I saw some blankets. What did you think of them? And she goes, well, they're the wrong colour, because she'd given up on her knitting because she was so anxious about the birthday and everything. She goes, they're the wrong colour. And I said, she goes, they just do not hold out, or you don't get the definition of the pattern on the TV. And I said, why goodness, I can't picture what you're trying to describe to me, but I could, but I had a plan. And so she started to knit what I was trying to not visualize in my mind of what looked good on the TV. And in the meantime, with her family's permission, I emailed ITV and said, I've got this amazing lady who is about to become 100, and wouldn't it be a dream come true for her if she could get what she thinks should be on the TV. And if we go to the next slide, Nick. Mabel's blankets made the TV. Mabel made 100 years old. And so on her birthday, the telegraph came from the Queen and a lovely picture of her blanket on the sofa arrived. And she became part of the Emmerdale fan club, she became a local celebrity. Would you believe it? After that, she died at the age of 106 and was in hospital once during that time. She found a new purpose, or she regained her hope. She got hope in life again. She became a local celebrity and she did outrageous flirting with the photographers. It was such fun to watch. But it was about empowering. It was about giving hope. It was about making sure that we found her purpose. So I think the power of the story, do not underestimate. So if we go to the next slide, it's our final one. It's any questions you want to ask about us in terms of finding purpose, etc. But I hope we've articulated and explained to you of how important the power of those words is, what matters to you, the power of finding purpose for people. And sometimes you have to be creative in that space. And sometimes you have to look and keep asking the questions in different ways to help. But my goodness, when you do, the joy you get, a bit like Mabel's story, I'll probably dine out on that until the day I die. But I think it's a really important thing to kind of go, actually, you can unlock potential, and some potential sometimes that the person doesn't even know, and you hold that power and do not underestimate it. So we thank you for listening, and hopefully that proved helpful.
Well, of course, Geraldine, that was absolutely amazing. Once again, you didn't disappoint. We asked you to come along and inspire people, and of course, you do that again. I'm going to ask people to hold their thoughts. I mean, that's such a powerful story just shared, and I'm sure people are sort of mulling over a lot of their thinking in their heads. So I'm going to ask people to hold that thought lightly at the moment and think about the questions that you might want to ask. towards the end of the session. Also, you've got these two wonderful ladies who did some amazing work last year around the deconditioning games as well. I'm sure you got lots of questions about what they did and what they found. And Deb already shared a few snippets early on in the slides as well. So have a reflect on that session from Geraldine and Deb, and we'll come back. But have a think about them, write them down, put them in the chat. That's absolutely fine, and we'll come back after we've heard from Joe and from Trish. But thank you once again for that story, Geraldine, and then all the information again from both of you, as well as you, Deb. Thanks very much. I'm going to hand over to Joe and Trish now. So Joe is a project lead with the Active Hospitals programme at Nottingham University Hospitals, and Trish is the chair of a patient partnership group in the area as well, and invite them to come along to tell us all about the work that they're doing in the area around deconditioning and reconditioning. So I'm going to hand over to I don't know who's kicking off first. Is it Joe? Are you going first?
Yeah, I think we'll both chip in a bit. So hello, so I'm Jo, and I am, as you say, the project lead for Active Hospitals up here at Nottingham University Hospital Trust. I'm an OT by background, and here is my treasured colleague Trish. Oh, Trish, you're on mute.
One of us had to do it. Hi, I'm Trish. I'm chair of the Patient Partnership Group. I'm a patient representative and a former carer of a young man with severe complex needs. So deconditioning is very part of my DNA.
And we've come here today to talk to you about our Keep Moving sheet and our Arts Trails aspects of the project that we're running. And we'll explain what we mean. So Active Hospitals, if you're not aware, is a national pilot that was run by the Office for Health Improvement and Disparity, and it kind of formally came to a close last autumn, but I was late in post, so I'm here till this autumn, which is very exciting. And it was funded by OHID and the National Lottery and Sport England, and we're building on work that was done by the Oxford University Hospitals NHS Trust, which has been published as the Moving Medicine website, and it's really worth a look. It looks at inpatients and outpatients, and there's a wealth of information and evidence and useful tidbits on that site. But the work we've been doing has been summed up on the next few slides. So here's our PDSA cycle. So we have been working with a number of wards, but we started out with one ward at the Queen's Medical Site in Nottingham. And what we wanted to do was to get them promoting physical activity and talking to patients about being active and encouraging patients to be active while they were on the ward. So the first thing we thought about was getting some patient information together, and Trish will talk you through what we pulled together in a moment. We also looked at an electronic assessment. So we've now got on our digital medical records, we've got an assessment of physical activity that takes the baseline of what people normally do when they're at home. So it compares to the Chief Medical Officer's guidance. It talks about how many minutes they do, and there's guidance for staff on how to do a brief intervention with patients about being active on the ward. We have looked to recruit volunteers to support with the Keep Moving sheet, and we'll explain what that looks like in a minute. And in terms of measurement, we've done a couple of things so far. So we've audited patients sat out for meals prior and following interventions, and that's been pulled together at the moment. We have looked at falls data, and we've also measured hand grip strength, and again we're measuring that, looking at that data at the moment. So on the ward, we provided them with the Keep Moving sheet. We trained staff up as physical activity champions, which is a national programme called the Physical Activity Champions Training Programme, and we trained most of the ward team and therapists on the ward to be physical activity champions. We've trained staff and volunteers in how to use the Keep Moving sheet and how to use the electronic assessment. We've started audits and we've started measuring things. And what we found so far is that the use of the Keep Moving sheet is increasing from when it was launched through to November, and it continues to increase. We found that we have managed to recruit 5 volunteers so far, with several more coming through, and they're delivering about 10 hours support a week. We're aware that not all patients are receiving the patient information, and we're looking at ways we can manage that. We're, as I say, gathering lots of data on, we're looking at red to green days as well now. We're trying to prove our worth, and that's very complicated better on an acute ward where there's so many different factors, isn't it? So we are looking at various things from the hand grip strength through to red green days, through to falls, through to patients sat out for meals. And what we need to do next is analyse all this data, but and we need to encourage more volunteers to get involved with the project, and we're looking in particular at trying to recruit a more diverse population of volunteers. We've got a very diverse population up here in Nottingham, and we want to represent that in our volunteers that are coming onto the wards. We want volunteers who speak multiple languages, who come from different backgrounds, and we do hope that we will be able to work with refugees and try and help people who want to come into healthcare get some experience. So we've got some big ambitions, but it all started really with the patient information. That was where the beginning of all this idea came from, and I'll hand over to Trish to talk you through that.
Right, thank you. This all stemmed back from lots of work that we had done at the hospital around MPJ paralysis, including having various posters for carers and how they could help with their loved ones. And then we were putting together a welcome sheet, and on one side it was all the various things about welcoming people onto the ward. And then we were really keen to make sure that we got the keeping moving MPJ paralysis, telling patients from a patient point of view what the benefits were. So this side was on the other side. We then took it out and piloted on about 10 wards. One of the things that came out from that pilot and the audit from patients was, please could we have some exercises? We really like this. We're starting to understand the importance. Is there any exercises we can do? So that's when I became involved with the Active Hospital group and took this to them and said, and this is the other side that has now been developed with physios, could we have some basic exercises that patients can do, whether they're lying in bed, whether they're sitting out of bed, at any sort of age could do. So we've come up with this, so that all the different exercises and the QR codes link into physios doing the exercises as well. So as Jo was saying, we've now got volunteers on the wards. So those volunteers are helping patients to do these exercises. And one of the other things that we want to do is to get family members and carers. Now visiting has opened up much more to help with this. The feedback has been so positive, and patients are taking these home with them, because what they want to do is to continue to do their exercises at home. So they're taking them home and they're showing everybody in the community. And recently I've done a couple of talks in the community around patient involvement and have been asked, when are the sheets coming into the community? Because it's getting out there now that there's these keeping moving sheets. So they're wanting to try and start it in the community, get people moving in the community and carry it on through the hospital and then back out into the community. I think this, from a patient point of view, this was devised by patients. And I think that is one of the real big key elements here, because it's in sort of patient speak on certain amounts of it. It's really taken off, and patients of all ages are doing these. It's not just in the healthcare of the elderly wards. It is right. It's going to be right across the organisation, and I think it's really important. And it's also important for people who have a learning disability, have looked at these, have looked at the exercises and found it really useful for them. And also those who have complex needs. So carers are doing it with their loved ones when they come into the hospital. I'm very excited about it, and as you can tell, and I think it's something that could be repeated very easily across the country. Yes, Jo.
So, as Trish said, we've had lots and lots of positive feedback. So here's a couple of our lovely ward staff holding the sheet. And in terms of reflecting on what's going well, the voluntary team has worked really well, and I think in terms of promoting the sheet and in terms of raising the profile of why we want to keep patients moving, having volunteers coming in specifically with that purpose, get staff really engaged, gets them really excited, everybody gets involved in trying to keep people moving. Everybody's got really excited by the hand grip strength measurement randomly, so they have competitions. They challenge themselves to try and improve it, so that's proved very popular with patients. And we've got a lovely information board on the ward where everything is stored, which helps with the volunteers when they turn up, which helps. It's right when you walk onto the ward, so it kind of opens up the idea of physical activity as soon as you get there. What we can do better, we need some time to analyse all the data we're gathering. So that's a real challenge. I'm constantly on the scrounge for registrars and junior doctors and anyone I can find, but obviously they're very busy, but anyone I can find to help me analyse the data. We talked about wanting more volunteers, and we need some more qualitative feedback. So we've got some plans to go and do some patient interviews, hopefully starting tomorrow actually, to get some qualitative feedback that's a bit more formal than the informal feedback we've had so far. We know that patients are being encouraged to be active on the ward, and we can see that from the digital assessment that we have. And it's great that they have exercises that they can do in bed and chair, because we all know how long patients spend in bed and chair while they're on a ward. And whilst that culture needs challenging and changing, it's also important, I think, to give patients something to do when staff aren't available to go for a walk with them or to take them away from their bedside. And as Trish said, patients are taking the exercise sheet home and they're very excited about it and very keen to get involved with the project. So next steps are to get more data, to analyse the data, more volunteers, rolling out to other wards. So we've got a number of other wards who are interested in what we're doing, and grand ambitions. We've got 90 wards at NUH, so we've got a lot of wards we could work through. So we're taking it in chunk-sized pieces, but we've got about 6 wards at the moment who want to get involved that we're starting to work with, and other people pop up all the time. And the other thing that came up as part of this work was that for patients who were very mobile and who were able to get out and about, they wanted somewhere to go away from the ward. So I'll talk about that just very quickly now. So the Arts Trail project. So what I'm doing with the, and Trish is involved as well, what we're doing with the arts coordinator at the Trust is developing some walking trails that link up the artworks we've got on the walls. We're putting up more artworks on the walls. We've got a lot in cupboards. So we're getting it all out, we're putting it all up, and we're getting some maps and plaques and all sorts of information to go up on the walls about keeping moving and what the artworks are about. We've also got a dance choreographer who's going to come and do some dance sessions that we'll film, and pictures of that will go on the wall as part of the arts trail. And the hope is that if patients have got somewhere to go and have a pleasant walk, they might feel more inclined to do so rather than just heading to main entrance in the shop to buy a chocolate bar. So I think that's probably us at time, but I saw a couple of questions. I did manage to respond to one, but we're happy to take questions now.
Can I
Brilliant.
just say, I think that the Arts Trail is one of the extra exciting things. We've even got patients who want to be part of the dance routines, and also staff that want to join in as well. So it's staff wellbeing at the same time.
Brilliant. Thank you, Jo. Thank you, Trish. I'd like to claim that we coordinated this, that we got the message from Deb and Geraldine about the seeing the person, not the patient, and seeing, you know, what matters to people, and then we have a great story like that about what a real story, real life story from a real patient and a patient representative as well, to say, well, this is really important for us. So I'd love to say that we're coordinating it beautifully, but we don't see the presentations beforehand. So it's all a lovely surprise to us as too. So thank you for doing that, and thank you for making it relevant and turning some of that information and all that, showing all that great work that you're doing up there as well. I know, Trish, we were talking before we started the call that you used to work with Anne-Marie Riley, who was on last week's call as well. So you've got a deep level of association and knowledge in this area as well. So great, and thank you for sharing some of that knowledge with us. There are a couple of comments in the chat. Lucy, have you picked up anything that we can share?
Yeah. So a couple of people have asked if they could have the slides after the presentation, and a couple of people asking for the exercise sheet, which I think is lots of comments about how helpful that's going to be. So if it would be possible to share that, Joe and Trish, that would be fantastic. Lots of comments, not that many questions. I had a question actually, which was a question for Joe and Trish. So really excited. Thank you so much. Really interesting and really helpful presentation. Do you have any top tips for a team or an individual who wanted to kind of get this started on a ward? Top tips for turning something like an exercise sheet into a live reality?
Yeah. So Trish, do you want to go, because you started it off, and then I'll pick up with how we implemented. So do you want to start with the idea and the kernel of everything?
I think the idea of it, I think, is to make sure that you've got patients and their carers involved in putting this together. I think one of those bits is really key, because that is what makes it live, and it helps patients to understand that. And we've actually promoted it, that this is patients for patients. And we had a large group of us together looking at what was important, what we felt was important. We were also looking at it from the point of view of carers as well. So getting your carers on board and what helps them to keep their loved ones moving is really important. So it's that co-production, I think, is the big key here, that I would say is the level of success, is having that co-production, working together on this, and also then working through this. And that's where Joe came in, looking at how we can do this, like bringing in volunteers to help. And we're now going to look at how we can train carers as well. So, and also new carers, because it's really important, especially on, say, a stroke ward, if somebody has a stroke. It's how you then help those carers to be able to assist their loved ones in keeping them moving and helping them to progress. So I think it's that co-production and people being there from the beginning right through and to continue.
Yeah, so I was so happy when Trish brought the idea and the work that they'd already done, because it was very easy to springboard from that, because it was a very clear brief. So we knew what we wanted. But my top tips were to get the right level of senior therapy support. So I'm lucky I'm a therapist. I knew a lot of senior physios, but I think that was really crucial in trying to find something that everybody was bought into, and obviously not, the exercise sheet won't suit everybody. It's not suitable for every patient that comes through the doors, but it's got a good kind of generic section of exercises, and when I show it to physios on specialist wards, they tend to go, oh yeah, no, they're okay. We do those ones with our patients. They're all fine. And if not, then we talk about ways around that and alternatives. Another top tip would be to get your shared governance and your kind of risk assessments and all the rest of it in line. So to make sure that everything is set up for staff to work in slightly different ways and for volunteers to come onto the ward. Getting the volunteer job description right and getting the advertising of that right has been crucial. We've actually been out to local universities to try and recruit people like from sports science and sports exercise medicine and physiotherapy, and we're working with the inclusion and diversity leads to try and reach out to different, more diverse communities, and advertise that as an opportunity. Measurement, try and get your measurement sorted. It's like an ongoing battle trying to work out how we can prove that what we're doing is valuable. So get your measurements sorted out from the very beginning if you can. We had something ideas at the very beginning, but we are continually developing on that one. and get senior buy-in from the wards. So get your matrons involved, get your ward managers involved, but also get your on the ground buy-in. So we trained up a lot of HCAs as physical activity champions, and some of our HCAs are our most engaged staff members on the ward. So you need everybody. You need to take the whole MDT with you. Yeah, does that answer your question?
Yeah, I think one thing that we had as well, because I chair the patient partnership group, I also have meetings with the chair and the chief exec of the organisation. So of course I promoted it to them and took them the sheet and made sure that they got the sheet of what we were doing, and that helps as well. There is that buy-in. If you get the buy-in from right across, right up to board. We haven't actually put them through their paces yet, but that will come.
Really powerful, yeah, really powerful message, Trish. I think that, and for both of you, Trish and Joe, I think, yeah, your patient groups sometimes have a privileged access to certain senior leaders in the organisation, and they often can say things that we maybe feel that we can't say in a rather direct way. So yeah, connect with your patient representatives, I think, is the message definitely there, and I'm sure. Connecting with Joe and Trish as well will share their experience further, will help. Any other question? Pop your hands up, pop it in the chat. Any questions for Geraldine and Deb? Anything about what they've heard today, or anything from the games last year? Any learning that you want to glean from them while we've got them? You've got them now, captive audience. They're not going anywhere until 2 o'clock. So please pop any hands up if you've got any hands up. Zoe.
Thank you. It was a message really to Geraldine and Deb, because it's amazing what you've achieved, what you've done, but it's more about how do you maintain that kind of energy, that, you know, it's a lot of it is real common sense, and we've become so focused over the last few years on the pandemic, on capacity, on challenges. The NHS is a really challenge place to work right now, so you're doing such incredible work. How do you maintain with all of our staff, you know, we're in the acute trust or within the community, how do you keep up this energy?
Take it first. I think we get a lot of energy, one from each other. I think we're very lucky. We're like two peas in a pod, myself and Debbie, and we get a lot of energy from each other. I think we work with amazing teams, and we get a lot of energy from everyone. I think it's quite an energizing campaign, because what you're wanting is very positive outcomes. And I think and when you put all your energies to kind of think, oh, actually, this is what we could do, and it's all very preventative, it's very easy to get people on board. But I think it's crucial to kind of use stories, to use the power of the stories, because there's each and every day at this moment in time, every minute, there'll be somebody doing an exercise sheet like Trish and Joe. There'll be somebody who's doing creative care planning to kind of get people up and moving. But actually, those stories are not celebrated. And it's important to celebrate those good stories, because they're the things that give people energy, and they're the people that give people traction. Because you're thinking, we've been through a hard time. And I know when we started this journey, and I know Amit and Helen was in the room when we initially had it, and we thought, actually, you know, we were on the cusp of going into a winter like no other. And obviously we've known now there has been other winters like no other. We thought, oh my goodness, what are we going to do in this space? Because we were conscious there was a lot of fatigue. There was, you know, a lot of people were in a sad state, you know, in terms of where they were, and you're thinking, how can we build resilience? How can we bring joy at work again? And I think it's just bringing the basics back. I think is really important, and getting joy and care again, and not making it too complicated. And Debbie, did you want to add to that?
I think all of the teams that were involved last winter, sustainability was really, really important to them. I think when people are involved in these kind of projects, and I know we're speaking to the converted on this call, but it really does energize the team. It really does bring joy and fun back into the workplace, and it really does make a difference. And I think the starting point is a lot of people feel that it's going to be more work, and people we're asking people to do something new, something different, and something in addition. But I think once they start to see that these small changes really do make a difference, really do promote and support improvement in their patients, and they see the benefits, it's a no-brainer. And I think we have grown reconditioning ambassadors. There is, we started off this campaign saying that we wanted to grow a social movement, and it was a real ambition right from the outset, but that's what it's done. It's a snowball effect, and the more people that get involved, the more people that see the difference that they can make, the improvements that they can bring about, and the difference that it makes not just to the patients and their families, but also to the staff. And I think the category of medal for staff wellbeing, working alongside the reconditioning work, has really been key to this campaign as well, because again, what it does is it really builds team morale, but it builds it makes teams stronger. It brings them together. They have a shared purpose, as we've been talking about today, and it gives energy. Yeah. And it's been a real pleasure and a joy to be part of this campaign and see a lot of this great work happening and starting. And it's really lovely that it's now spreading and growing.
Yeah, we couldn't be prouder, really. And I think it's about with the staff as well as making sure people know they matter too, because I think sometimes people don't always feel they matter. But it's been really interesting in terms of some of the case studies. You could visually see them kind of having a spring in their step, so you can see them going home, kind of going. And I think that's so important. And I think when we've seen all the case studies come through and the amazing pictures and the Twitter feed, my goodness, even as tired as you'll be, you'll just keep going, because actually it's gaining an awful lot of ground and it's really making a difference. So what's not to like?
And I think, as Amit's put in the chat, I think what the teams have very much seen is that when you start to focus on reconditioning and preventing that harm from deconditioning, that it does reduce overall workload. If you have those conversations about the importance of supporting people to walk to the toilet or to walk back from the toilet rather than using bedpans and commodes, people feel quite overwhelmed by that whole idea because they're so busy. But what they start to see is if you invest that in the first few days of somebody's admission, that then the independence and the self-care of that individual really do improve. So yeah, and the proof is in the pudding.
Brilliant, really wise words. I think there's a few key bits there about starting small, just start doing something. That's what we've heard both from Geraldine and Debbie, Joe, Trish. We hear it all the time from people who are on this programme, who are doing this work, that we just started small. And there are a couple of people on the call, I've just seen some names here, and they're doing some great work, but it all started from something, just one thing. And often we just get over that initial barrier, which may be a little bit, we haven't got time for this. Well, you've heard a lot of reasons today why we should have time for this, and it will give us back time later on. If there's no more questions, I'm going to take a little bit of chair's privilege on this one, just to share a bit of information around people on the call and anybody else who's listening to the recording. I have put a link in the chat. I'll share it again back to the Futures platform, where it's got all the information that you'll need. There's a weekly medals update. So we have over 50 organisations at the moment taking part in the games. If you feel like you're on your own, you may feel a little bit isolated in your own organisations, but you are connected to a much wider network across the whole country. We've just gone into Wales, first medal coming to Wales, so it's not just England either. We're starting to see interest from around the world actually in the deconditioning games. So you're connected to a wider purpose than just where you may feel a little bit isolated on your own at the moment. Geraldine and Debbie mentioned about a social movement. This is about a social movement. There are no rules. Good job, really. If I'm going to do with it, you guys will find the ways to do things and figure it out. But there's resources on the platform just to give you some ideas and inspiration. Go there, have a look, apply for medals, celebrate your successes, celebrate your teams and the work that they're doing. The medals process is really simple. There's a little bit of information you have to submit, but not a huge amount. And that gives you a sense of reward and a sense of success that you're doing. I think it's about 490, nearly 500 medals now have been awarded to the various categories since we started in November. This is huge, and behind every single medal, there's a person and a patient. There's something different is happening for those people. There's an activity of reconditioning for every one of those medals. Just keeping that in mind constantly. There's across the whole country at the moment, so you are part of something bigger than you realise, even if you just take one step forward. So that's my little chair's speech. Our next learning event, please join us for that if you can. Share if you can. I'll put the flyer in the chat as well. That's on the 22nd of March. It's with our old friend, I shouldn't say old really, he'll have me in the stocks for that message. Our good friend Brian Dolan is joining us on the 22nd of March, and also Rachel Moran from Warrington and Hulton Trust to describe their active hospitals programme, which they're connecting to the reconditioning games as well. We've also got a tweet chat coming up. Anybody who's involved, who's on Twitter, we're hosting a tweet chat at 7 p.m. Later on this month. Again, we'll put some more details in the chat around that as well, where we can just share lots of information. It's about an hour, and we'll just be able to share lots of knowledge, and lots of questions will be answered. So please join us with the tweet chat if you can. But for now, if there are no other questions, I'm going to give you all back 7 minutes of your valuable time. Go and get yourself a nice cup of tea, maybe a biscuit. I'm going to just thank Geraldine, Debbie, Trish and Joe for your time today. It's been really inspirational, and I'm sure this recording will get lots of hits as a result of that. But thank you everybody else for joining us today, and we'll catch up at the next learning event, and have a good rest of the day and the rest of the week.